Everyone, and welcome to today's program. At this time, all participants are in a listen-only mode. Later, you will have the opportunity to ask questions during our question and answer session. You may register to ask a question at any time by pressing the star and 1 on your touch-tone phone, and you may withdraw yourself from the queue by pressing the pound key. Please note this call may be recorded, and I will be standing by if you should need any assistance. It is now my pleasure to turn the conference over to Ms. Barbara Kaplan. Please go ahead.
Thanks so much. Welcome to the American Lung Association's webinar, Living Well with COPD. My name is Barbara Kaplan, and I'm the Director of Lung Health Education at the American Lung Association's National Office, and I work in Washington, D.C. I'm being joined today by an expert panel of speakers that I'll introduce you in a moment. But first, I want to thank you for joining us today and for taking the time to submit your questions early. Our hope is that you will leave today's discussion with new ideas on better ways to manage your COPD. And hearing from you and the questions that you submitted ahead of time was very helpful in helping us shape the information that we wanted to present on today's call. We selected the most common and frequently asked questions to discuss during the first part of today's webinar, and then we're going to move to a live question and answer period. So I'd like to take a moment to describe some of the features for today's call. We recognize that some of you may be listening by phone only and are not able to join the web portion of the call today. All lines are in a listen-only mode, but there will be an opportunity to ask a question by phone a little later on. If you have joined us by computer, we have prepared some visual elements to help guide the conversation, and those with computer access have the option of entering a question in the Q&A field that's available on the right-hand side of your screen. You simply type a question into the field and click the little icon or submit button. We will cover how to ask a question by phone a little later on. I would like to take a moment to say a special thanks to Synovian Pharmaceutical for their support of today's call. And now I'd like to introduce our expert panel of speakers. I'll start with Dr. Maylon Han, who is an Associate Professor of Internal Medicine at the Division of Pulmonary and Critical Care Medicine at the University of Michigan Health System and the Director of the Women's Respiratory Clinic. Her research interests include defining disease phenotypes in COPD in particular through radiological characterization of disease. Dr. Han is the principal investigator of 2 large National Heart, Lung, and Blood Institute-funded COPD cohort studies at the University of Michigan, the COPD Gene Study, and Spiromics. She is also the associate editor for the American Journal of Respiratory and Critical Care Medicine and a member of the Scientific Advisory Board for the American Lung Association. So welcome, Dr. Han. I'd also like to welcome Valerie Nagel, who is a registered respiratory therapist and is the coordinator for the pulmonary rehabilitation program at the Tri-City Medical Center in Oceanside, California. She's been involved in the field of pulmonary rehabilitation for 24 years and for 39 years overall in the field of respiratory medicine. Valerie is the coordinator of an American Lung Association Better Breathers Club at the Tri-City Medical Center and has been leading that club for 24 years. So welcome, Valerie. I'd also like to introduce Mark Courtney, who is a specialist with the American Lung Association's Lung Helpline, and he works in Springfield, Illinois. Mark has been with the Lung Helpline since its inception in 1999. He has worked in respiratory therapy for over 30 years as a therapist, a supervisor, an educator, and he's currently a part-time staff therapist at a local acute care hospital in Illinois. As a specialist with the Lung Helpline, Mark helps people in their efforts to quit smoking, provides information and answers questions regarding lungs, lung disease, and lung health. He also responds to internet chat and email questions from all over the world. And finally, I'd like to introduce you to Harold Whitnall. He's a Vietnam veteran who struggled on a daily basis with COPD. Harold's lungs has collapsed 5 times in the past 40 years, beginning when he was 25 years old. Today, Harold has become an expert at the daily self-management of COPD and just completed his 3rd Fighting for Air climb. So I'd like to welcome all of our speakers today, and I really want to start with this special message and congratulating Harold for completing his 3rd American Lung Association Fight for Air climb. This is one of American Lung Association's signature fundraising events. These unique events are hosted in prominent skyscrapers, stadiums, or arenas, and they challenge participants as they walk, run, or race up hundreds of steps. So you completed 532 stairs, Harold.
Yes, I did.
Tell us a little bit about who is in that picture with you.
Well, starting from your left on the screen is Wes. I'm next. After me is Debbie, and the young one on the end is Ashley. These are 3 of my therapists, pulmonary therapists, who have helped me get where I'm at today. And they have actually made my life a real pleasure. The youngest one on the far right has done it with me for 3 years. She's been my inspiration and the main soul of the whole thing. It takes quite a bit of training, but I've done it for 3 years. I did it this year in 29.36 seconds. So 29 minutes and 36 seconds. So it's not bad.
That is very impressive, and I'm sure a lot of our listeners today are wondering just how did you do it? Any tips you can share?
Well, I take the steps to the point where I feel a little bit of burn in my chest. I back off and stand over to the side. Of course, I'm using pursed lip breathing all the way through it, but I use it a little bit more. I catch my breath, get my strength back up, and I'm ready to go again. I made about, I figured 7 stops this time versus 8 the year before. So as long as I can make my stops and keep moving, I'm good.
Well, thanks so much for sharing your story, and I look forward to hearing you throughout the question and answer period today. I know that the folks calling in today will have a lot to learn from you. So
I will be here whenever you're ready.
Perfect. Thanks so much. So one of the things that we did in preparation for this call today was to take a look at some of the most common and frequently asked questions that were coming in. So thanks again for submitting your questions early. But several of the questions revolved around disease progression. And so I wanted to start with one of the questions that came in. And maybe I'll start with you, Dr. Hahn. What can patients expect with a diagnosis of COPD?
That's a really, really broad question, and I think it depends a bit on how severe a patient's disease is at the time that they're diagnosed. I think we've got a lot of good treatments that are now available, and so I think patients can expect to have a doctor that's compassionate. I think patients should be able to expect that they'll receive some type of lung function test to confirm the diagnosis. And then that their doctor will develop an individualized treatment plan for them that probably will involve some type of inhaled medication therapy and, in many cases, pulmonary rehabilitation.
Great. I'm going to continue on. With disease progression, COPD symptoms are top of mind. So let's talk a little bit about symptoms. Common symptoms of COPD include coughing, shortness of breath while doing daily activities, mucus production, feeling like you can't breathe or take a deep breath, and wheezing. So Dr. Hahn, I'll start with you again. What do you recommend to your patients to help them better recognize flare-ups? Or what can they do to prevent flare-ups?
Right. So flare-ups are a term that you may hear thrown around. Your doctor may also call it an exacerbation, which is just a fancy word for flare-up. we know that patients with COPD experience intermittent worsening of their symptoms. Now, there's day-to-day variation that everyone experiences, but when we're talking about this particular type of flare-up or exacerbation, what we're really talking about is the sustained worsening over a several-day period associated with often increased cough, shortness of breath, wheezing, sputum production, sometimes fevers, chest pain, chest tightness, et cetera, that isn't going away with your usual treatment. Certainly if you experience these symptoms at home, the first thing to do is to increase your short-acting inhaler use like an albuterol, but it's really important for patients to know that if they have a sustained worsening, then that's really the trigger for them to call their physician to talk about what other management steps can be taken. We can treat exacerbations. Usually this involves antibiotics and steroids. The whole question about how to prevent exacerbations is sort of the holy grail of medicine and of research right now. We certainly know that there are medications available that will help, and we have several inhaled medications. There's actually some oral medications that can be considered, and so this is definitely something to talk to your doctor about.
Great. Thanks so much. So we received many questions about how to manage breathlessness. And one question that really resonated with me was, what can I do about fear of not being able to breathe? Valerie, I've heard you speak before about the dyspnea cycle or the cycle of breathlessness. And I was wondering if you might take just a moment to describe the cycle of breathlessness.
Sure. What happens when you start to get short of breath, till you learn how to control this, is you become more out of breath doing typically an activity, then your breathing becomes very shallow, which causes you to start this panic, so your muscles start to get tense, and then you get more anxious because now your breathing is becoming even worse. So then the shortness of breath gets to the point that you're almost in a full panic, so you quit doing any activities or a lot of activities that make you feel short of breath, which is going to make you more anxious when you have to do just little things like get up to go to the restroom. And it just keeps going and going till you find the only time you're comfortable is sitting in a chair, and then your muscles become very atrophied, and that's going to make everything in your life a lot worse. So controlling the breathing is the main goal for you, anybody with shortness of breath.
Great. And Harold, if I could start with you, are there any tips or tricks from your experience to manage shortness of breath when doing everyday tasks?
Well, after I've learned the purse-lip breathing, I've got to the point where anything I do it at my own pace. And if I do start getting shortness of breath, I will stop, rest myself, and then continue on after I've got it under control. And I can pretty much get through the whole day with purse-lip breathing and just going at my own pace. I don't try to overdo it.
Mm-hmm. Great. And Valerie or Mark, any other strategies that you might recommend to listeners today to use to manage breathlessness?
Well, I think Harold really hit it there when he said pacing himself, because after you do learn the diaphragm along with breathing, along with the purse-lip breathing, you really do need to learn to do things at your own pace, not to rush activities so that when you get done with them, you're completely exhausted. So stopping and doing the breath saver positions or getting the breathing back under control is very important to be able to get through your activities of what you need to do every day.
Terrific. So the next topic questions that came in were really around COPD management. For example, in the area of medicine, COPD medicines to treat the disease, which are the right medicines to treat, or which were the best medicines to treat. So maybe I'll ask Dr. Hahn if you could comment about, what are the right or best medicines for patients with COPD to take?
That's a great question. So we have a couple of different classes of medications, and so when physicians think about medications for COPD, we tend to think of classes of drugs. There's a lot of different brand names that might be within those classes, but I think for today's discussion it's helpful to think about the classes. So we have the short-acting bronchodilators, which are great for immediate relief. And then we have longer-acting bronchodilators, which come in two flavors. One we call the long-acting beta agonists, and one we call the long-acting anticholinergics. And increasingly, patients may find that these are being lumped together in the same inhaler device, so that a patient can experience maximal bronchodilation. We also have inhaled corticosteroids, which may be appropriate for some patients, certainly if you're having frequent exacerbations or patients that have some asthma overlap, or sometimes patients will think about for inhaled steroids. And these are also available in combination with bronchodilators. And I think patients are going to notice over the next couple of years that there are increasingly different combinations, and I expect we'll have what we call triple combinations available in the next few years, where all the steroids and different types of bronchodilators are all available in one. There is data to suggest that these bronchodilators improve symptoms, exercise tolerance, and can prevent exacerbations. Those are all really good things. There is some data that hints that medication therapy may actually be able to decrease the rate of lung function decline. That's sort of just being hinted at right now. But there are a couple of interesting studies that suggest that may be the case, which would be really great if it were. There are also a couple of other type of adjunctive therapies that are available to treat COPD. In the last few years, there's a pill that's come out. The class of drug that it comes in is a PDE4 inhibitor. The one that's currently available in the U.S. is called roflumilast, and this specifically can help reduce exacerbation frequency for patients with frequent exacerbations or flare-ups that we talked about, who also have symptoms of chronic bronchitis. So that means kind of daily cough and sputum production. It's really that subset of patients that roflumilast is best able to help. And then there are some other therapies which I should specify are not FDA approved specifically for COPD, but may still benefit individual patients. So for instance, the antibiotic azithromycin has been demonstrated to reduce exacerbation frequency. And so those are sort of kind of the general classes that the patient needs to be aware of, but it's really a discussion that needs to occur with the patient and the physician to talk about whether there might be other options that are available.
Terrific. Thanks so much. I'll just remind folks that as you listen to our speakers present, if it is drumming up a question for you, don't hesitate to go ahead and enter that question in our Q&A box, and we will try our best to address that during our live Q&A towards the next half of our call. Continuing on the theme of COPD management, we recognize that medicines are really important to the overall control of COPD, but there are other things patients can do as well. And so I wanted to start with the area of pulmonary rehabilitation. And maybe, Valerie, I'll ask you, since you've worked in pulmonary rehab for a number of years, can you describe the benefits of pulmonary rehabilitation for patients with COPD?
Pulmonary rehab, for anybody with a breathing problem, whether it's COPD or even other lung diseases, what this program does is it's both education and slow but progressive exercise. And what that does is the increasing your stamina or increasing your energy, which will in turn make your muscles work more efficiently, and then what happens is you become less short of breath. The education part is to teach you how to be in charge of your lung disease rather than your lung disease being in charge of your day. So by giving you the education aspect of it, teaching you about how to use the inhalers correctly, how to do the diaphragm breathing and pursed lip breathing, how understanding all the different inhalers, which is unbelievably confusing these days because there's so many new ones out. Anyway, it gives you the education aspect of it so that you can control this lung disease. And once we get the muscles in better shape and you're breathing more efficiently, then you get out of that panic cycle and you're able to do all of your daily activities that you need to do by pacing yourself.
Terrific. And I'll just ask a follow-up question of Harold. We heard at the top of the call about how pulmonary rehabilitation has really made a difference in your life. And one of the questions that have come in was about someone participating in pulmonary rehab, really getting a lot out of it, but then their insurance runs out. So I was curious, has that been an issue for you, and what are some tips that you can share about, continuing with pulmonary rehabilitation or exercise even after your health insurance runs out?
Well, I was very fortunate. I take my pulmonary therapy at Memorial Medical Center, and after my insurance ran out, I was able to continue with the same group at the same place for a very reasonable price. I'm paying $45.60 a month for 2 days a week, and to me that's well worth it. But they also have a gym set up here in Springfield that's called the Y that also has a registered nurse there to assist people in pulmonary therapy with their problems, and that's $10 a month, and you can go there anytime you want, any day, any hour of the day. So there are other ways of getting it, and if it's going to help you, it's really worth it.
Mm-hmm.
The benefits from it, they're amazing.
That's terrific. I think that those are some great suggestions. And Valerie or Mark, I'll ask just, it's working in pulmonary rehabilitation, are there exercises that you can recommend, after pulmonary rehabilitation ends for patients to continue at home?
Oh, absolutely. The strength training that you're instructed to do during a pulmonary rehab program, that helps get the muscles in also stronger, obviously, and then you need the endurance part too. But the endurance part of the exercise, if you don't have a gym to go to, if you don't have the access to a Y, you can also just go walk in a grocery store and if you're on oxygen, you put the cart there and you can walk at your own pace. And I know we have a lot of patients because we're in a very hilly area where we are, and they can't just go walk in their neighborhood, even though we have the great weather. So what they like to do is go to someplace like Walmart or Costco that is a huge store and just kind of walk up and down all the aisles doing their breathing techniques. But the strength training is just as important and also balance exercises, because a lot of people, when they have breathing problems and they're doing less and less, then a lot of times the balance becomes an issue.
This is Harold. Could I break in a minute?
Sure.
I myself have bought an elliptical. What days I'm not in therapy, I use my elliptical at home.
Oh, good for you.
I live in a small town. I walk from my house to the post office, which is a good half-mile walk every day, or I ride my bike. And in the bad weather in Springfield at our city mall, the doors are open at 7 o'clock in the morning for anybody that wants to walk the mall free of charge. And it is very large. There are 2 floors to it. There's free walking for anybody that wants to walk it, and you see them walking in there every day.
Terrific. I think those are some great tips and strategies. And so we'll continue, I think, for our next question. We'll continue with, we touched on breathing exercises a bit. Valerie, you had mentioned diaphragmatic or belly breathing and also pursed lip breathing. But I think we'll touch on those a little bit later because I have some resources to share towards the end of the call. I thought we could move along to this question around tips to recommend helping people stay active and healthy. Dr. Hahn, I think there are some misunderstandings about weight. Some of the questions that came in, patients are being told to lose weight while other patients are being told to carry a few extra pounds. Are there any comments that you could share about nutrition and COPD?
That is a really interesting question. We know that not all COPD patients are alike, and we're beginning to understand that in particular certain types of lung tissue abnormalities may predispose patients to or be associated actually with certain body types. Patients who have fairly severe emphysema tend to also be really thin and have a hard time keeping weight on. And in those patients, I do worry about them getting to be too thin because then they won't have the capacity to, for instance, survive an acute illness. Maybe they'll have a bad pneumonia where they aren't eating as much, and then they get really dangerously thin. So for my patients with severe emphysema and who are kind of on the sort of what I would consider dangerously thin, then I really do work with them to try to see what we can do to help keep weight up. On the other side of the spectrum, and this is by no means set in stone, I'm just giving everyone sort of a rule of thumb of the kinds of patients I often see, but certainly there are going to be patients that don't fit this mold. But patients that have what I would say is more chronic bronchitis as opposed to severe emphysema, where the more predominant symptom and abnormality, if you were to look at their CT scan, is more large airway thickening and mucus production, those patients tend to be heavier. And in those cases, having some extra weight on is going to be associated with increased shortness of breath, difficulty exercising. And so for those patients, I might recommend trying to lose some weight. So I think for all patients, really the goal is to be somewhere in the middle, not too skinny and not too heavy. Not too heavy because it makes you can make you short of breath and make it difficult to do things when you've already got impaired lung capacity. You don't want to be carrying around, extra pounds because it's extra stress that it puts the lungs on. But on the other hand, you don't want to be dangerously thin either because it leaves you no reserve. So the ideal weight is really, for most patients, somewhere in the middle. And so for every patient, that might be something a little bit different depending on where you're at. We've had a lot of discussions about pulmonary rehabilitation, and I think for many patients that's a great place to start because there'll be access not just to exercise, but often nutrition counseling. Getting additional nutrition counseling is always something that you can talk to your physician about. But there are many of my COPD patients ask me, well, is there any data if I eat specific foods that it would be better or worse for my COPD? There really is not a lot of data to suggest that one type of food is going to be better or worse, or patients should try to have a high this or a low that diet. I think as a general rule of thumb, you want to achieve a healthy diet. So a well-rounded diet, fruits, vegetables, high in fiber that we would recommend for, I think, most patients so that you can stay as active as possible and try to maintain a weight that is sort of somewhere in the middle. But because of the unique nature of COPD and the kinds of abnormalities that some patients have, I also realize as a physician that it's easy to say that, but actually achieving that healthy weight, depending on where you are on the spectrum, can take some work.
Great. That's, I think that's very helpful. And maybe I'll just open that question up to the rest of our panel members. Are there any tips that you would recommend to help people stay active and healthy?
Well, I think one of the things that a lot of people don't realize is their oxygen needs a lot of times are reduced if they get their weight down. We've had patients be able to drop by 1 or 2 liters or even get off of oxygen just from getting their, especially if they have a lot of midsection weight, making it more difficult to breathe. So one of the things that we always recommend if they have the capability is working with a dietitian and or a lot of the doctors in our area actually like the patients to go to a program like Weight Watchers only because it's a already known quantity and where you're going to learn to eat healthy. So that's what we do for our patients.
Great, thanks so much.
Mm-hmm. I try to stay active every day. If I can't get outside, I find something in my home to do. My wife still works, so I take care of our home. I keep it vacuumed, I keep it dusted, I do all the laundry, so I try to keep myself active. That way I've got plenty of time to go out and have fun with my grandchildren.
Great. I might have you come over then, Harold. So moving on with COPD management, we can't really talk about managing COPD without touching on oxygen therapy. And we received a number of questions about oxygen therapy. So I guess I'll start the conversation with Dr. Hahn. What are the most important things patients should understand about oxygen therapy?
That's a really loaded question. I think we could spend the entire hour on
yeah, right?
So I'll really try to boil it down in a nutshell. COPD does lead in many cases to some lung destruction, and therefore it decreases the capacity of the lungs to pick up oxygen. And that's why many patients receive supplemental oxygen. The data that drives oxygen use in this country is from 2 landmark trials that were done, I think, in the 70s, that showed patients who had persistently low levels of oxygen. And when I say persistently low, I don't mean patients that have oxygen saturations above 90% on room air at rest, but then drop with walking. I'm talking about patients that are really low all the time, so kind of like low 80s and below all the time. And those patients were found to have a survival benefit when being treated with oxygen nearly continuously. So many physicians, and I would say it's sort of the standard of care currently in the U.S., is that we've extrapolated the data from those 2 landmark studies to say, well, if I have patients that temporarily desaturate, oxygen must be good for those patients too. The fact of the matter is we actually, despite doing that, don't have a lot of good evidence for that. And so the National Institutes of Health has partnered with CMS or Medicare to fund a very large study that just completed called the Long-Term Oxygen Treatment Trial, where they studied whether patients who have intermittent desaturations with ambulation but are not persistently hypoxic benefit from oxygen in terms of decreased hospitalizations and survival. So the results of that study are not yet available, but I would tell the patient audience to stay tuned because the data is expected to be available in the next few months. So that issue aside, many patients do feel that their dyspnea is improved and they can walk better, et cetera, with oxygen. And for those patients, I'm glad that they do experience a benefit. For other patients, I think they view their oxygen a bit as an albatross. They don't want to use it. They don't like using it. And depending on the results of this trial, it may alter how we think about using oxygen in this country. The one caveat that there's a couple of caveats with oxygen. I know that getting oxygen delivery systems, ease of using medical equipment companies is a constant source of headache for patients. And all I can say, and I'll let our patients speak about this, and our respiratory therapists speak about this more, what I can say from a physician standpoint is that it is driving you nuts. Talk to your physician. Actually, back up. Talk to your physician carefully about what oxygen you get prescribed the first time, because it can be frequently difficult to change. So really query your physician. Talk to your equipment company about what type of oxygen delivery system would best suit your needs and lifestyle. But if you have a system you don't like, it can be changed. It just may take some persistence. The other thing I would say about oxygen is that the lungs do two things for us. They bring oxygen in, but they also expel carbon dioxide. And supplemental oxygen does not help with expelling carbon dioxide. So, and in fact, in some patients, getting too much oxygen can actually lead to decreasing the respiratory drive and further increasing carbon dioxide levels in the body, which can lead to confusion. Now, this is not the case for all patients, but it is the case for a few patients. And so sometimes you might hear your physician say something, or your respiratory therapist say something about not wanting to have you on too much oxygen. And that's the reason for it. If we have patients that have high carbon dioxide levels, then the treatment is not supplemental oxygen, but rather we will use something like what's called a BiPAP or a CPAP device, which is a mask that we can put on the patient to help kind of push air in and also help expel air, which can help relieve some of the carbon dioxide problem. So that's sort of a lot in one statement, but I think the issues surrounding oxygen therapy are really different for every patient. Some people are going to be concerned about their device. Some people want to know what it's doing for them. So I get lots of different kinds of questions about oxygen. So I tried to touch on a lot of the pieces that are frequent questions, at least among my patient population.
Great. I think that was a very helpful response, I think, to think about oxygen, and definitely I think giving our listeners something to go back and have a conversation with their healthcare providers about. Are there any other comments from our panelists about oxygen? I know, there are questions about what is the ideal level of oxygen to maintain, and any comments from Mark or Valerie? Or
This is Mark. We get a lot of questions. Some people are wondering why their oxygen level is good and they're still short of breath, even on supplemental oxygen. And I think some people have the misconception that oxygen will relieve all of that shortness of breath, but it doesn't really reverse the lung disease. So it's going to protect the organs. It's going to help make everything work better at a higher oxygen level that's in the normal range, but it doesn't have that much capacity. So I think Dr. Hahn touched on it a little bit. It's probably one of the things why people don't use it at first, or why we have some compliance issues, is because they don't really feel like it helps. If they had that pulse oximeter, they would be able to see that it helps, and over time it actually helps people live longer. So I mean, that's a clear benefit.
Thanks, Mark. Well, since I have you talking, Mark, I think I'll move on to our next question. The next set of questions that really, came in around stigma, and I think I wanted to be able to, how can we help our listeners today faced with the stigma living with COPD? Whether it's a family member who makes comments about their smoking history, or the embarrassment of having a coffee pit in a public place, or people staring because of oxygen use. What recommendations do you have for dealing with the stigma of living with COPD? And Mark, I'll start with you.
It can be really tough. I think I learn a lot from patients like Harold that are actually out there doing things and dealing with it, and you really can't let it slow you down. I think some people kind of have to come to the realization that they're a little bit different. They're not the same person that they were before they were faced with this disease. I'm sure Harold would have a lot more on it. The COPD Foundation has a little article called Shame and Blame where they talk about how, I mean, you get it kind of from both sides of that stigma. The first question a lot of people will ask is, do you smoke or did you smoke? And that stigma is carried with not only with COPD, but with a lot of lung cancer patients as well. And you know, nobody deserves lung disease. You don't do something and set out to harm yourself. It's, you know, you're actually, you know, trying to help things, and when you are faced with this diagnosis. So I mean, I think that's where the Better Breathers Clubs comes in. You can interact with other people and find out what they're going through and what things they've done. I know a lot of people tell us that if they see somebody staring, they just go up and start talking to them about it. Tell them, you know, this is my scuba tank, my oxygen tank. I need this to be able to get out of the house and do things. And some of that kind of takes away a little bit of that uncomfortableness. But I'm sure Harold and a lot of other patients have a lot better advice on exactly what to do. You kind of have to live your life. You have to find a way to get past it and you know, get as high a quality life as you're able to.
Mm-hmm. Yeah, and I think you touched on a key aspect of the social support, and you know, learning from your peers and other people living with COPD. Do any of our other panel members have any comments around stigma, helping patients deal with some of the comments from friends? And
this is Harold. I personally really don't know what that feels like. The main reason I started pulmonary therapy was to stay off of oxygen. And I, to this day, after 5 years of pulmonary therapy, am still not on it. Mm-hmm. And hopefully I can stay off of it for a little while longer. I know what's coming. I'm prepared for it. But right now, if I can stay away from it, I'm going to do what I have to do it.
Well, I'm going to continue to be your cheerleader for that as well. So terrific. I think we are ready to move on to our live question and answer period. I see that we have a number of folks who have started to populate our question and answer field on the web. And so I'll turn it over to Don, our operator, to give you instructions on how to ask a question by phone.
Certainly, at this time, if you would like to ask a question, you may press star and 1 on your touch-tone phone. Again, that's star and 1 on your touch-tone phone. If you find that your question has already been answered, you may remove yourself from the queue by pressing the pound key. And we can go ahead and take our first question from Barbara Klein. Please go ahead.
I had a few questions that I typed in the box, but one of the questions that I have, so I was just hospitalized in the beginning of December, and I was in for 7 days with very bad exasperations. So I didn't realize how bad my COPD is, and I have a lot of problems with anxiety, but I also have a really difficult time with what they call grunting, and I tried the pursed lip breathing. So I guess my question is, on this pulmonary rehabilitation, how do you get involved with something like that? Is that something I should talk to my doctor about or seek out on my own? Or because it's a scary type of situation for me, and just being new with this, a few months later I'm still trying to manage and go to work and do the things that I normally do, but it's really been difficult for me.
Well, I'd like to answer that. How to get into a pulmonary rehab program, it depends on if you can find one in your area to start with. And if you can, it can be any physician as long as you qualify for which would only be moderate lung disease, your doctor can refer you to the program. If there isn't a pulmonary rehab in the area, one thing that you will find extremely helpful, even if you have to leave work to get to a meeting, is the Better Breathers Clubs. Because I know that our Better Breathers Clubs in the San Diego area here are very involved in trying to make sure that the new people that come in get the kind of resources they need. So I think that that's a way, but definitely if you have a lot of anxiety and you're doing a lot of grunt breathing, really focusing on learning the diaphragm and breathing techniques is going to help you. And sometimes you really need to get help with that. If they don't have a program, sometimes you can actually have the doctors just refer you to a pulmonary department, and they'll do a little one-on-one education with you. And then the other thing, as I understand, is the Lung Association now has some more information on how to do the breathing techniques. Like the breathing, I think if you could control your breathing a little bit more comfortably, then the anxiety level would be reduced.
It's when this happened to me in December, I couldn't breathe at all, and I actually had to call 911. So when the paramedics came to take me out, I mean, I was just like, I thought I was dying. I thought like that was the end of the world for me, and went into the hospital and a lot of steroids, antibiotics, oxygen and things like that. So really now trying to manage this and those thoughts and kind of feelings just, I don't know, they just don't go away. So it's really difficult for me sometimes to manage.
Mm-hmm.
So I was really glad to see this, and I was happy to be a part of it because up to today, I've really not had opportunity to ever talk to anybody. So it was nice to listen to Harold's story and all of the things that, you guys have been talking about.
Yeah, it's very scary when you're sure that this is going to be it when they're taking you to the hospital and you can't breathe. It is extremely, becomes very anxious for you. Sometimes that I know that our patients do talk to their doctors about this, and sometimes the anxiety and depression needs to be treated a little bit be treated with some medication. So that's something you could talk to your doctor about too.
Mm-hmm. Yeah.
And this is Harold. My doctor is the one that got me into the pulmonary therapy. So talking to your doctor, best thing I ever did.
Okay.
Yeah, that's the perfect place to start.
Yeah. And just last question I had, and I know I'm taking up all the time here, but for the oxygen level, like what is really truly an ideal oxygen level?
Does Mark want to answer that, or do you want me to, Mark?
It doesn't matter to me.
You want your oxygen level to be above the saturation number of 90% all the time, which means when you're walking around, which means when you're in your deep sleep. You'd want to keep that oxygen. You don't need to keep it 94 or greater all the time, but you need to try to keep it like 90 to 93 would be perfect, but it has to be with all of your activities, not just sitting, which is when a lot of people check it.
Yeah, that's the thing for me is that I think when I'm walking, it may drop below 90.
Okay, you need to report that to your doctor because the doctor can change your oxygen prescription.
Mm-hmm. And actually, I am on no oxygen now at all.
Oh, okay, but if it's still doing that, the doctor needs to know that, and he or she should have further testing to see if you would benefit from oxygen, and it's a very simple test. In pulmonary rehab, we do something called a 6-minute walk test, but I know our hospital here also does where you can go in and they can walk you around to check things out that way too. But they can be ordered by the doctor. Some of the doctors here just take you down the hallway and walk you right in the office just to get it documented.
Oh.
Yes, my doctor does. This is Harold again. I was at where you are right now at 90% oxygen. And today, after I did the climb, when I was doing the climb, the lowest my oxygen got was 96.
Oh, wow.
So it does help. So there's a little bit of encouragement for you.
Yeah.
Thank you. Yeah, I'm looking forward to those days to get back there. I have also quit smoking. Was a smoker for 30 plus years, so that was difficult for me.
Good for you.
I was a smoker too. I'm not ashamed to admit it. It's something I wish I'd never done, but
I'm almost at, I think, my 10-week mark now, so I'm really proud of myself for that accomplishment as well, and I think that that's going to also help me. So
Absolutely.
immensely.
So, all right, well, thanks. I appreciate you guys answering my questions.
Thanks so much, Ms. Klein. Operator, we might have time for one more question.
Next, we'll go to Nancy Rossano. Your line is open.
Oh, okay. Thank you. Oh, hi. I just wanted to ask what you thought of the salt therapies that are out. We have one here in Arizona. And I was wondering how beneficial you thought they are for people with lung problems.
So we do get a lot of questions about alternate therapies, and I don't know if Dr. Hahn or any of our speakers have any comments about salt therapy or alternate therapies for treating COPD.
I have to admit I don't know much about salt therapy, and I think it's a little bit difficult to comment on alternative therapies in general, just because they're all so different. I have a lot of patients that come in, for instance, and ask me about things like probiotics or supplements that they'd like to take. In general, I'll look at the label and make sure. It's very difficult because a lot of things that you buy over the counter, while they may have very potent ingredients in them, because they're not regulated, you don't know a lot about the concentrations, and it's also very difficult for physicians to try to look at things like drug-drug interactions. So it's a little bit difficult to comment as a blanket statement. I will say across the board, I'm not aware of any large clinical trials, for instance, that have suggested efficacy, but that doesn't mean that if you as an individual patient find benefit from a particular product or therapy that it isn't still a worthwhile thing to do. It's just difficult for me to comment on.
Okay, thank you. I appreciate it. Your advice.
Terrific. Thank you. So, operator, I'm sure we have a few more questions in queue, but I'm looking at the time, and we are running out of time a bit. And I had some closing remarks. I did want to make people aware of a few of the American Lung Association resources that might help address some of the questions that we are getting in. So I do want to thank everyone for their participation and for your questions. They really are great. What I'd like to suggest is if you have a question that did not get answered today, for you to go ahead and reach out to one of our lung health specialists at the Lung Helpline. They can be reached at 1-800-586-4872. Just in case those of you who don't have access to the screen. You can also send a chat message through online, and you can visit the helpline at lung.org, and you do the // helpline. So I would encourage you all to pick up the phone and have a conversation with a respiratory therapist like Mark, who has joined the call today, and I know that they'd be happy to help you with any questions that came in. I did want to mention, because this came up a few times during the call, and that is encouraging you to practice breathing techniques as a way to manage your COPD. And there are two types of breathing techniques, pursed lip breathing and belly breathing. We have some videos available online that are available on our COPD landing page on lung.org. So we hope you'll come visit us at lung.org, and you can access these videos online. And it's a great way to practice at home. If you can find the time, and we'd love to hear what you think. Also, another video, we didn't talk too much about inhalation therapy or inhalation technique, but we do have 2 videos about nebulizers, learning how to use a nebulizer and how to clean your nebulizer. Surprisingly, how to properly clean a nebulizer is one of our most popular videos. And so if you haven't cleaned your nebulizer lately, I'd encourage you to take a look at our video and give it a try. This is a great way to stay healthy with COPD. So these 2 videos are also available at lung.org/COPD. And we, again, love to know how these resources are working for you. Valerie mentioned our Better Breathers Club, and she is a long-standing facilitator in the San Diego, California area. And you can find a Better Breather Club near you, also on our website. And if you just go to lung.org/better-breathers, you can find a club near you. This is a great way to get some social support and peer-to-peer interaction. And for those of you who need any additional support and maybe an in-person group program isn't right for you, we also have our online support community, Living with COPD. And this has been a great resource. And Mark, sometimes I know you're on Living with COPD, helping patients and answering questions. So please come join the conversation online if you haven't joined us already. And lastly, I just wanted to mention clinical trials. We had a number of questions about emerging therapies for COPD. We didn't really get to touch on this topic too much, but clinical trials are regulated research studies that try to find better ways to prevent, screen for, diagnose, or treat a disease. And so I'd like to encourage you to check out our clinical trials page on lung.org and consider clinical trials as soon as you're diagnosed and every time you have to make a treatment decision. So you can visit our webpage to learn more about clinical trials, find out if they're right for you, and find maybe an active trial that you can participate in. At the end of today's call, we will be sending out an email with a link to the recording of today's webinar. We'll also provide a link to a survey. We would really appreciate your feedback. So please take our end of program survey. We look forward to hearing from you. Lastly, again, I'd like to thank our speakers, Dr. Hahn, Valerie Nagel, Mark Courtney, and Harold Whitnall. Thank you so much for sharing the information today. And also our sponsors for today's call, Sanofi Pharmaceuticals. Thank you, everyone, and I hope you enjoy the rest of your day and look forward to an email from us. Thanks again. Take care.